Injectable testosterone replacement therapy, or TRT, is the traditional way of administering testosterone. The advantage is that it's very bioavailable, so all the testosterone, because it's being injected, is being absorbed by the body. Second, it only needs to generally be injected once, maybe twice a week. And so the frequency of the application is less frequent, although it does come with the downside that it will suppress your own testicular function and fertility. Now, you can take HCG along with that to mitigate that and maintain some of your testicular function and fertility if you combine both of those together. It still is the most popular option because it's been around the longest, it's tried and true, and you know that it works. People generally feel pretty good on testosterone replacement therapy when it's injected. And so if you're looking for that kind of tried and true option, you can do so, and you can get it for as cheap as $99.99 a month. So it's relatively cost effective as well.